We're going to get started. It's all in the family. It's really great to see you all. It really is. Want to welcome, Gina and I welcome our audience today. And we're going to talk about, I just think, a very pertinent topic to many families and seniors that are considering home care. And that's how, in choosing a good home care agency, what do you ask? You know, what's important to you? And you'll see there's hundreds of choices. So this is a very important. And with us today, we've got some wonderful resources and people, and I'll introduce them shortly. And I always like to start with a quote, but in this case, I was kind of looking through. We have a third-party company that actually calls all of our clients, called Home Care Pulse, and they talk to both our caregivers and our clients. And this is Cantdecide, and when you choose a good home care company, this is the type of response and love you can receive. And I mean, you can read the words. We have some tough times. Angela, all of us here love our own families or working with clients. There are some tough times, but all it takes is one client to turn around and say, "You're a godsend. Thank you for helping my family." And it's indescribable. So, we really appreciate Ken in saying this, but this is what can result when hopefully you have done your research, you've asked people, you've looked at reviews, and you've worked with someone. It can transform your life. And that's what everybody in this call is about. We share a common bond. We help people. So with that, let me introduce today's speakers before I get into today's agenda. So I'm gonna do something a little differently right now. I'm just gonna kind of go into a spotlight mode. How do I do this? Oh, I have to stop sharing my computer for a minute. Hello, audience. It's us. Okay, I am going to introduce Mr. Scott Waterhouse. You are live. Hello, Scott.
Hello there.
Scott is the Director of Information Resources at Resources for Seniors. He's just a great individual in our community that really is at the heart of this directory, which I'll let Scott speak to later, but amazing resources in the community. Everything you want to know about senior care, the directory has. But more, Scott's also, a lot of people don't know, he also volunteers time in the community. It's an honor to serve on the board of the Dementia Alliance of North Carolina with Scott. And the other thing people won't know unless Scott tells you, shares his bio, that he's an amazing artist, and he has incredible artwork all around people with Alzheimer's. So, thank you for participating, Scott, and God bless you for what you do in the community.
You're welcome, and thank you.
Okay, I'm going to switch over to, there's Angela. There she is. This is Angela Woodard. And Angela is a geriatric care manager for the great group of people at Preferred Living Solutions. Say hello, Angela.
Hi, everyone. Thanks for having me.
And we'll, at the end of the presentation, we're going to get into a Q&A panel with Scott and Angela. I would introduce Lisa Ogburn from Aging Well, but Lisa appropriately is taking care of a client today, right before this, and God bless her, she's awesome. She sends her regrets, but she's a great person in the and then of course my wife. This is my wife, Gina. Gina is the Director of Aware Senior Care and the driving force behind what we do. Thank you for joining us, Gina. Okay, I'm going to share my screen. Are you all seeing my screen now?
Yes.
And you're seeing the PowerPoint now?
Yes.
Thank you.
Great. This is, in all doing these, this is the first time I've had some hiccups with it. So sorry about that. So in understanding home care, what is home care and what is not? People get kind of confused between home care and home health. And one thing is we created, if I can do this correctly, we created this very simple tool that you can download from our website under the Circle of Support and Discharge. But we decided to create a card that kind of explained what home care is with regard to home health. And home care is non-medical, whereas home health is medical and doctor ordered. And that's kind of, if you can remember that, that's the key differentiator. And then home health, basically the client makes the call on what they need and when they want it and who they would like. It's typically private pay, although VA and attendants can pay for it. And then some people have long-term care insurance. And there's services where you have personal care, companion care, meal prep, housekeeping. These are all services. So this is a tool we created that can be downloaded. But there's also some other great resources I wanted to show real quick. If I can do this. Okay, they're not there. So I have to go back to my presentation. There are other links that we can follow here in resources for seniors. I'll open up a link. I just wanted to show you this, but resources for seniors, if you go to their website, has a homepage dedicated to educate you to what home care services are. And again, Scott will talk about directory, but I wanted to show you this, wonderful resource that you have, which explains it, how you pay for it, Medicaid. So it's right in a directory that Scott will talk to later. So I don't want to steal that thunder, but it's a wonderful, wonderful resource. And then the other is the North Carolina Department of Health and Services and Regulation. If you visit that website, you will actually go to a page where they've written a consumer's guide to home care. What is home care? Why home care? So I think, step one for a lot of families, what you recommend, whether it's in North Carolina, I'm sure each state has resources similar to this, is to do some education, show you understand what home care is. And that's an important step to do before you get going. So now that you understand and think you want home care, where do you start? Well, the challenge that you're going to be faced with is that there's hundreds to pick from, just hundreds and hundreds of home care agencies. And in terms of resources, I listed some for you. Typically, a lot of people will do a search engine. Resources for seniors directory, you saw that there's what is home care, and then there's a whole section that lists over 100 home care agencies. So here's your challenge. If I do a search on home care carry, you bring up what you typically see is AdWords. These are paid for advertisements by home care agencies.
We're not seeing anything right now. We're still on PowerPoint.
Oh, still on the PowerPoint? Okay. Thank you for telling me that, Kyle.
You could post the links to the PDF as well.
Yeah, we can do that.
Yep. Okay. For some reason, I thought this should, I guess I have to get out of stopping this share and go to another. But when you do a Google search on home care, you will come up with hundreds of choices. And in the beginning is AdWords where people pay, and then there's organic, where you won't see that ad. Those are the companies like ours that we don't advertise. It's all based on content we're publishing, and then they rank you. So one thing of advice is to kind of watch that. You'll see ads, and then you'll see ones that are not. The Resources Seniors Directory, I'll let Scott talk to that. In fact, let me see if I could stop the share for a minute. Okay. Is everybody seeing the Resources for Seniors Directory right now? Okay, this is what this is. This is a directory for everybody that Scott will speak to, but the directory is an amazing document that has, like I said, all these chapters about home care, adult daycare, housing. It's just a wonderful, wonderful resource. So I just wanted to show that very, very quickly. And let's see if there's another one I wanted to show. We're getting back to this. Everybody should now see Google. And what you'll see is I talked about the AdWords there. And then you scroll down and then you'll see the non-AdWords and some of the companies there. But it's quite an extensive list. So I guess the point that I'm just trying to just kind of illustrate is you've got kind of lots of choices. Okay, there's other resources I listed there for you, the senioradvisor.com and caring.com. If you go to those websites and you put in home care, you can put in a zip code and it will bring up all the companies in that geography and rank them by reviews. So it's a really good resource. Okay, so it really comes down to when you're looking for home care, it really is like the dating game. It really is. I mean, we're really dating ourselves here with the dating game in 1965, but when you see home care there, they're all sitting on chairs is, who do you pick? So some of the things that we've heard, and I think people will attest to, is frequently when families talk to us and we ask them, what's important to you? Some of the things you're going to hear is consistency, that families want a reliable caregiver that performs their duties well. And they love my dad or mom. And following that passion, they're looking for a caregiver that really has that passion, and it shows when they're caring for somebody. Reliable, dependable. This is a key one. A lot of people maybe try private home care and trying to manage it, and then somebody doesn't show up and they're sick and they get frustrated. So what they're looking for is people are dependable. And if a caregiver is sick, that the agency has somebody in the backup. And then proven. Recommend to you if you're reviewing home care companies that you really look at the ones that are highly reviewed, right? What are families saying about them? And then if you can find reviews by caregivers, that's even a better. So I kind of put together a short list for you of things to consider. But really what it comes down to is you and the family and what's important to you. But here's some recommendations. The first is reviews, is when you're looking for a home care agency that you go, whatever, it's senioradvisor.com or caring.com or Google, look for reviews from clients and what they're saying. You obviously, in forming a short list, find the ones that are most reviewed and you're seeing good things. Awards and recognition, it's just a way to validate that they must be doing something right. If people are giving the company awards, what's their story? You go on a website. If you go on our website, we kind of followed Simon Sinek and we kind of told a story about why we're doing it, and it's kind of important to see, why the owners are doing what they're doing, what do they believe in, and so forth. I think that gives you a good feeling that they're not just in it for money making; they're in it for their heart. And then other things, breadth and depth of services. How deep are their services? Companion care, personal, skilled nursing. Are they a team player? If you go up to the website, are they working with other companies? Because we like to coin a phrase that elder care is a team sport. And then there's some other important things. For the sake of time, I won't read each and every one of them, but these are all things that, forming your list, my recommendation is what's important to you, form your list, whether it's Google or Senior Advisor, come up with a short list of maybe 5, and then start making your calls. So what I'd like to do at this point, let me see if I do this correctly. And I'd like to introduce Mr. Gregg Mazza. Gregg was so kind of us to join. And Gregg was I thought, a great person to speak to all of you in that he was owner of a home care agency, and you can see Bright Star Home Health for 10 years, and somehow he survived. And
Wow. I got a lot of
and
gray
now,
hairs and lost some, but I'm good. I'm okay.
you know, what Gregg went from that, and I think like a lot of us, when you go through some things in home care and you learn what to do, maybe what not to do, and you have that passion, you want to pass it on to everybody. And that's what Gregg moved on to form his own company now called Home Care Breakthrough Solutions. And now he's, in which we are kind of a member of and follower of. And during COVID, he's been out there, he's been guiding, he's taken a leadership role, and has some great, has some great experiences. So he's going to join us here for 5 minutes. And Gregg, I'd like to turn it over to you to kind of speak to the audience on your experience.
I appreciate you guys. Thank you so much, both of you, having me here. One of the main reasons why I agreed to join is because you guys do so much for the community and for other home care owners, and that means a lot to me. So I agreed to jump on here and help out in any way that I can. Like Tim said, I had a home care agency for 10 years, and we actually started the business in part because of what my parents went through with my grandmother. My grandfather passed away from leukemia, and in their relationship, my grandmother did not drive. She didn't even know how to write a check. So here she is, 80 something years old, and just her whole life's turned upside down. And thankfully my parents retired and they moved down to Florida. And at that time, so this all happened before we had our home care business. We didn't even know about home care. We didn't know that it existed. We didn't know there's an option. And I see so many families struggling with, and I tell, my mom hates when I say this, but it's true. She aged 10 years in a matter of 2 years because of the stress and the overwhelm of, running back and forth to see my grandmother. She did not want to move into assisted living. She refused to move in with my parents because in her mind, she didn't want to be a burden, even though, we all loved her tremendously. That was just her thing. But it was a lot, just going back and forth and back and forth. And we did not know about home care at the time. And I see so many, after talking to so many families, I mean, we had over 150 caregivers that worked for us. And a lot of times there were families that would come to us because they had a bad experience. And there's no such thing as perfect. I'm not going to sit here and say, hey, we had the perfect company, because you're in a people business. And, sometimes you can cross the T's and dot the I's and do everything. And then you still have someone that does something. You're like, it's not a good choice. But, you know what I mean? But on the front end, you, as a consumer or someone that's considering or looking at home care, there are things that you can start to look for to make sure that it's the right fit for you. Of course, in everyone's life and everyone's decision-making process, of course, money is a factor in the decision-making process, but it's not the only thing, because no two companies are exactly the same. And I think for people that are wondering, what do I look for? Like, I've never done this before. For most people, that's the case. They have a crisis, mom fell, dad fell, or we saw this coming down the pipeline and now it's time. We're worried and we want to get some help for mom and dad. And there's a lot of variables to look at. I think you mentioned some earlier. I jumped on a little bit earlier of like, what are the services that they offer? One thing I didn't see on there that I know you guys do, because I remember watching the video, like you were one of the first ones early on with all of this coronavirus stuff. Like you had your caregivers in the room training them on like, how do we handle this? Or how do we do certain things? And not every company does that. So I think one thing to look at, and you had it on there, is like, how do you retain employees? More importantly, like, how do you treat your staff? Right? How do you treat people in general? And you can't always tell that by, hey, I'm calling up a home care agency, but you can ask the questions of, how, what kind of training do you have for your staff? Sometimes you can ask what types of programs, if any, do they have? Getting a feel for the heart of the owners definitely matters. I think you talked about having their story. There are people that do this just for the money, but there's also people that do it because there's a mission behind what they're doing. And I feel like with you guys, that's exactly where you are. It's like you have this heart and this mission to really help and serve. And it makes a big, big, big difference when something comes up and, people like you will go above and beyond to rectify, to do the right thing, and to make sure that people are being cared for the way that you would want to care for your mom or your dad or your loved one.
Right on.
It's not always easy as a consumer because you call in and you're just, what do you ask? Like, okay, tell me, are you, are you licensed? Are you bonded? Are you insured? Yeah, a lot of companies are. Some may not be, but outside of that, it's just really getting to know the company and what they stand for and how they treat their employees and how they treat their staff and the process, right? The process, right? Yes, we provide help with dressing and toileting, and all of those things, but every individual has individualized needs. So it's not just, hey, I need help with bathing. It's, when you get to know what that particular individual wants and needs and what their goals are, and then you have a process to make sure that it gets carried out in the home, that's different from company to company. And one thing I know about you guys, just watching you and observing you, is that like you guys are on point with a lot of things. And, I have no doubt that like, if I was looking for home care and considering companies, like I wouldn't have any doubt. I could be like, okay, let the Murrays handle it because they're going to do it and they're going to do it well. So, those are some of the core elements that I believe will help people as they're looking to figure out, okay, what does my mom need? Make a list of what we think she needs help with. And then sometimes as a consumer, you don't know what you don't know, meaning there are times where the company can help you with other things. You just don't know what those things are. So I'll give you a perfect example, right? So someone who's a diabetic, well, that person might need help with bathing and dressing, but what about like meal preparation, making sure that we're preparing meals that are more diabetic friendly, or doing blood sugar tests and things along those lines. So there's sometimes where you don't know the things, all the other things that they can provide, and a company like you guys, you have a plan for that and you address it. And, I'm imagining you guys put together a care plan so your caregivers know what they should be doing when they get out there. So hopefully this helps you guys.
Thank you.
No, Greg, I really appreciate it. And no, seriously, God bless you for what you're doing out there and the leadership of, especially during COVID-19 and the various home care agencies are struggling with various things. And I appreciate you spending time with us and sharing some of your thoughts. So thank you very much.
I hope it helps the people that are on here, and best of luck to you guys. You guys are amazing.
Oh, thanks, Greg.
Thanks, Greg. We
All right.
appreciate it.
All right. So long. Bye-bye.
Take care. But I think before we introduce the family Cantdecide and have fun, a couple things with Greg. You can see there's a heart is a lot of this. And when you call the home care agency and you're going to describe your mom or dad or the situation, that's when they're going to really shine. And how they take that call, are they listening? And do, like Greg said, do they have build a custom care plan? The other thing he said is, and it may be hard, but what are the employees saying about that company? Because if you find employee reviews and they love working for that agency, that speaks to something. So, and we can more on that later, but at this point, I want to introduce the family Cantdecide. And the reason we're doing this is, as you can imagine, with the family, siblings, the client, everybody has their own opinion of what they're looking for in home care agencies. So we wanted to, when Angela speaks and Gina and Scott, we're kind of addressing multiple audiences. So the Cantdecide family, Lucy is the client, and she's kind of reluctantly coming to the point where she really needs some services. So she lives in a 2-floor colonial in Cary. She's age 83. and she's recently widowed. Her son, Fred, is the moneymaker. He's an entrepreneur in hair replacement, as you can tell, and he's been very successful, but he's got in his head kind of what he's looking for. And then there's Ethel, the daughter, who's the Raleigh inner belt line, divorced and remarried 3 times, and she has her own opinion on what she's looking for, what Lucy needs. So the situation is that Lucy suffered a recent fall and a permanent hip injury. So she has limited mobility, uses a rollator and walker, but she's kind of shut down in some social activities, and that's one of the reasons she's interested in home care and having some help and a companion. She's reluctant to drive. She's not a very good cook, so that's also part of her criteria. Now, Ethel and Fred believe that Lucy has early dementia. They're seeing signs of not normal aging, and they've become very concerned about her. So they also feel that either A, she needs home care, or B, she may move. And Fred wants Ethel to move, and Lucy thinks she's just fine in the home. They also feel she needs to get out of the house, and they heard something about adult daycare. So the setting has been set for the various stages. And let's just say Ethel and Fred called in-home care, and they're speaking to Gina. How would you approach speaking to the two of the family of the 3 of them?
So am I meeting the 3 of them together in the house?
Let's just say you're meeting with the 3 of them in the house. That would be good.
Okay. So that's typically how home care starts, because we want to look at the environment where the potential client lives. So that's the first thing we drive up is we take a look. Okay, it's a 2-story home. When we're talking to them, we're asking about mobility things. And we try to make it just a conversation, even though we call it an assessment. And I direct my questions to Lucy, to the potential client, because I want to hear how she feels. Tell me about your mornings. What's it like when you first wake up? And that you ask questions and you just start to listen. And you listen to her say, well, it takes me a while to get dressed. It's hard to get out of bed. By the time I finish getting dressed, I'm too tired to make breakfast. So you start to paint a picture of like, okay, what are the points? We'll say, well, you've told me you're reluctant to drive. So how do you get your groceries? Oh, that's okay. My daughter does that. Oh, that's okay. My daughter, she does my laundry too. Oh, my daughter does this. So we turn to the daughter and say, so, Ethel, how's that going? Oh, you work full time. Oh, you're spending a significant amount of time on tasks with your mom, and you have children at home, and you're trying to work and take care of mom. So you're starting to see, what do we need? What do we need here? We have the son going, she's fine. She's fine. You don't need anything. You don't need anything. You're fine. Maybe we talk more about, now we are sheltering in place right now, but if times were different, what were the things you like to do? Are there things that you've stopped doing because of this injury and your new change in mobility? So she does talk about wanting to be with friends, being out. There is adult daycare, which is wonderful. So even though I'm there doing a home care assessment, the right resource may be for her to go to adult daycare. So she gets that socialization. She is around people to fulfill her needs. And some of the daycares, adult day centers, can provide personal care. So if she's afraid of taking a shower, that can be provided at adult day. So I'm really collecting information, listening. I might hear a little bit of concerns. The son has one agenda, the daughter has a complete different agenda, where I might then recommend, sometimes it helps to have a single point of contact. And there's great people at Preferred Living Solutions who can help you with that. There's some concerns about memory issues, thought processes. There's resources in the community like the Dementia Alliance and more from resources for seniors. So I would take information, I listen, I ask each person what's most important to them. That's the really big thing when we're forming a care plan. And if those ideas are in conflict, then I really recommend getting to go on to an aging life professional and see if they can kind of get everybody on the same team that really backs the potential client, because it's her life, and how does she want to live her life? So
I think, and if segueing to what do you ask the home care agency in choosing a home care agency, what Gina just described, you can see if in a conversation you call the home care agency and during that course they don't say what's important, most important to you,
Right.
then take the initiative to say, well, here's what's most important to me. And if you look at Lucy, she may say, well, it's what's important that I have some say in the caregiver. And you might want to address that.
Right. So one of the most important things about home care is while we're matching the skill set and the availability and the days of the week, one of the most important things is a personality match. And we can't really do that with with our computer software. In the assessment, oh, she's very chatty. She wants a person with her who will, talk with her and go do things. Where a different client might want, I'm quiet. I don't want a chatty caregiver. So you're trying to get the attributes of a caregiver while you're doing it's that dating game match. You always have the right to say, I want a different caregiver. And you don't have to give a reason. Now, we'd want to know if something went wrong, but sometimes it's just not a good fit, and that's fine. So we actually make follow-up calls after the first visit, after a couple visits, because sometimes people are hesitant to give us that feedback. I don't want her to lose her job. I'm like, no. We want you to have the best person with you. And that should always be the focus, is that it's a good fit for the two of you.
Right. That's that criteria. That's great. What's important to Lucy was having that sense of control and say in the care and how you do that. From Fred's perspective, Fred may think she needs to go to eventually the community. So one of the things you could ask the home care agency is, how do you work with a community and providing some temporary care, which home care can,
Right.
which is important. So Lisa, unfortunately, is not going to be part of the call, but she was going to address how she works with home care agencies when it's kind of a situation they're looking to possibly go to a community, but they need home care in the interim. So those are important facts. So I want to move on to kind of have a perspective from an aging life care professional, which is Angela. And not a lot of people know about this wonderful profession that can kind of take the point for the whole care team holistically. So Angela, could you share just really briefly what an aging life care professional can do to helping the Cantdecides and working with home care? And then in your experience as a geriatric care manager, what have you seen that are just great attributes from a home care agency that you would recommend someone to look for?
All the things that Gina had mentioned in terms of, being flexible with the caregivers, or having, if the person who's receiving care, if they want someone else, that's really important for an aging life care or care manager as myself to look for in home care companies. This scenario, this topic brings me back to about 8 or 10 years ago when I was working with a lady real quickly. She was recently told by her doctor that she could no longer drive. She had about 20 cats outside that she fed, things like that. She ruled the roost. I'm not sure how we even got into the door. Her daughter, felt like she could use some in-home care assistance and things like that. And so, we got there. We quickly determined that yes, some in-home care would help. But how are we going to get her to agree, to do that? And so, again, as we talk, it all really comes back to relationship building and things like that. So again, this was honestly, I think this was about 10 years ago when we were, fairly new as a care management company, and trying to really, figure out all the key players. And clearly, home care is crucial. And developing those relationships with home care companies and knowing who's going to be there, who's going to do the things that they indicated that they are going to do. That's so important. So with this particular client, she had, she finally agreed. Yes, let's get some in-home care, but I want this person to be able to drive me around on Fridays. I've got, this to go to, this, I got to get my hair appointment done. I'm going to the bank. I'm going to Dollar General. I'm going to my lunch spot. And so she had all these, criteria that that she did on Friday. And if an in-home care person could do that, then yes, she could come in and help me out in the house too.
Mhm.
So, it was my job at that point to see if I could find a home care company. And unfortunately, at that time, again, I'm fairly new to the business, don't know a whole lot of home care companies. And again, unfortunately, the one that I chose was not a great one. I was there to make that introduction, and they didn't get a phone call, no explanation or anything like that. And there I was, my name on the line. More importantly, Preferred Living Solutions name is on the line. Even more important, I got this lady here who is feisty. She's is her way or no way. And I'm down with that. I want to give thing that we can potentially give to this lady and make her life great, all that good stuff. So that particular Friday, I took a ride all day long. We went to all those different places, which was fine. But that led to discussion about we've got to figure out if I call someone, a home care company, I need to know that they've got my back. I need to know that what they say that they're going to do, and they will, and they follow through. And I know that it was at that point I started really getting to know in-home care companies, and certainly without a shadow, if and not to boost aware, but literally, if I know that if I've got a family, if I call Aware Home Care, I know the caliber of people that come from your organization, and I appreciate that as a care manager. So because clearly that helps me help the family, and it just
Yeah.
feels over. So
Well, thank you, Angela. That's a good. I know Lisa's not here, but to segue kind of what Angela's saying about having your back, Lisa, WRL, she has Aging Well column, and we've been working her for a number of years. We have Preferred Living Solutions, and she helps families in that transition. And in this situation, they can't decide. And they may be going to a community, say a month or so down, but they need the home care. And that's where we've teamed with Lisa many times with families. And I asked Lisa, what are the kind of things important to you? And something Angela said is that we have her back. She's at the point like Angela is, and know that responsiveness. And one of the things you can ask when you call the home care agency, you're feeling them out, is how do you communicate with me? How often do you check on me? If there's an issue, how do you handle it? And communication is really, really huge. And that's what Lisa admires, is just being communicated to. I have a problem. Gina and Mike, our staff, are back to her immediately. She says, you don't know what a good feeling. And sometimes it's not all good news. Like Gregg said, it's the people business, and people can surprise you at time. And I think it's, you can ask that question, how do you guys handle adversity or, an issue?
How do you respond?
Right.
Yeah.
So that's something you want to talk to the home care agency. What again, like Angela and Jared, care managers, is just knowing there's responsiveness, that if there's any issue, good, bad, whatever it is, they have their back. So asking about communications is something good there. Okay, it's time for the closer. And that is Mr. Scott Waterhouse. Let me see if I can find Scott. I should have asked. I'm asking Scott to start his video, but Scott is, like I said at the beginning, he is the Director of Information Resources. There he is. And Scott serves on the board of the Dementia Alliance, which I mentioned we both do. But Scott's at the head of this, the Resources Senior in the Directory. And Scott, I'd like you to share a little about when people call Resources Seniors about home care, how can you help them? How can Resources for Seniors help them?
Well, that's the great thing. Our database we have a lot of companies in there. We also um, mentally keep the good ones in our mind. We can't traditionally say this is the best one. That's not the easiest thing for us to do, but we do keep in mind the ones we've heard good things about, the ones that have a history of not providing a good source of service for the individual needing the care. So we're constantly, just like Gina said, the biggest thing we can do is listen to what they need. We provide on our website, we have a questionnaire. I'll just show it. You can't see it, the light's too bright, but it's choosing a home care agency. And most home care agencies have something like this available, just like y'all do, Tim. Uh, you want to, when we talk to them, we tell them to be prepared to ask questions. Don't call up and say, I need home care. They don't even think about what kind of home care they're asking for. So it's important for us to listen to them and ask them questions to figure out exactly what they're looking for. Because just like you started out with, the difference between home care and home health. There's a difference, and families don't think about that. They want home care. That's the term they've heard, and that's what they want. But they don't
Understand it.
understand the difference between the two. All they want is someone to come in and take in. And when they call us up, they say, I need a bath. My mother needs help getting out of the bed. She needs help getting dressed. And they give us this criteria. And a lot of times the caregiver focus is getting themselves out of the picture and someone else in there to do all the things that they just can't do anymore. Uh, Typically, we get the calls when the person is totally stressed out. They've been trying to do it
Yeah.
for
Yeah.
themselves for 6 months, a year, or more. And a lot of them are spouses because they feel this commitment in their marriage that it's my job to take care of that person now. Well, you're taking on a two-person role when you do that, not a one-person role, because you're doing everything you're already doing and you've added this new task on top of it. And that can kill a person, and it literally has. Just very quickly, I had a person when I was working in Johnston County. The wife took over for doing everything for the husband. He had dementia. She was bound and determined to keep him home. And every time the children called, she says, we're fine. And that was the end of the conversation. After 6 months, she ended up in the hospital from complete exhaustion. And she had to spend 2.5
Yeah.
weeks in the hospital. The children had to come in and take care of daddy, which daddy was 6'6" and almost 295.
Wow.
And when he didn't want to do something, you couldn't move him. And we had him in our day program for a while. Really a nice guy, but she just wouldn't tell people about it. So we utilize the resources. Our database has almost 2,000 listings in it, and you can find all sorts of things. Home care is a constant, especially in our market, because we have such a big population and a diverse population in the Wake County area. So there's a lot of things that we work on. Our listening skills is the biggest thing. We've taken classes on person-centered. That's the big term right now that's out there. Hospitals use it, home care agencies, and everybody. We focus on the person, and what people need to realize is they need to find out what's important to that person and what's
Right.
important for that person. If you can
Right.
get those things found out, you can provide what they're needing and what they want, especially. But I challenge everybody to go to our website, look at our resources we have available at resourcesforseniors.com, and then you'll know what to ask when you're bringing someone into the home. I'm sure Gina and Tim, both y'all come across this every day. You walk into a house and they just want home care. And they
Right.
want it. and they haven't thought about it. They just want it done. And it's partly to relieve
Yeah.
stress. But it's patience and perseverance is what comes into play in providing home care and home health to individuals.
Yeah. Well, thank you, Scott. I think everybody can see the directory on the screen, and it's a tremendous resource that Resources for Seniors publishes. And like I said, I showed this before, but you can see everything you wanted to know about resources for seniors, whether it's adult daycare, home care, housing, Medicaid, seniors. It is an amazing resource. It's free. Where do you get it? You can visit the website. You can download electronically. Scott has copies. They go out. They do a lot of events, but it's a wonderful group. So thank you, Scott. So at this point, I would like to go to the Q&A and actually unmute Micah. And Mike, I know during the course we had several. I saw questions come across. So if you could please just fire away for the last, let's see, 5 minutes or so, and we'll get the panels involved here.
Yeah, no, we have had some questions come across, and if anyone has some additional questions, please feel free to type them in the little chat box there. But no, some good questions. So, Ms. Gino, as far as home care is concerned, how much does it cost, and will my insurance cover it?
Well, I'll handle the insurance first. So we are non-medical, even though people think that bathing and dressing is medical. It's not. So medical insurance like Medicare does not pay for home care, typically. There, hopefully in the future it might, but right now, for the most part, it's private pay. As Tim said, there's VA aid and attendance if the person qualifies for that. And then long-term care insurance. We do a lot with long-term care insurance, but it's typically private pay. And it varies based on what the client needs. So we have a range from whether they just need companion care, which no personal care, no hands-on care, up to personal care and dementia care. So for us in Wake County, we range from $24 an hour up to $26, and then we do have a couples rate also, which is not double the cost. So,
right. I think just some advice to those that they're forming their list of questions to ask. Certainly, there's discussion on price. In fact, Micah does the majority of our service inquiries, and we have a standard at the end. If they haven't really asked about pricing or how much it's going to cost, based on what they say in the hours, we do the math for them so they understand what that cost is. And I'd advise families about putting costs kind of lower on your list. You know, you kind of get what you pay for. If you base it on who's providing the lowest hourly, that may not be the best choice. So thank you for asking that question. How much it costs is right up there.
Yeah, people have a lot of that on their mind. Yeah, absolutely. Ms. Angela, so what does a certification in geriatric care management mean? So what does that mean? Why is it important to me?
Yeah, I think that, in a nutshell, I think it just provides credibility, for the company, and just, shows our commitment. There we go. It just shows, our commitment to the association, and it just gives another kind of oomph, I guess, if you will, to geriatric care management. It just, another set of skill sets. If there's anything that new that we could learn or anything like that, it just keeps us more in the loop of that genre of care management.
That's expertise in care management. It's official certification, which has a lot of meaning, especially when your family's at stake. So thank you.
Yeah. Mr. Scott, first off, thank you for publishing such a fantastic resource in that directory. But if someone has questions about the services in that Resources for Seniors guide, who would they reach out to? Who would they contact?
You can call our information department. We get what's called a request for inclusion for everybody that's in our database. And so we have more detail that we've learned about the company, and plus we've experienced them out in the field and at events as well. So we have an opportunity to talk to these people through our speakers bureau that we have. Our information specialist, our department altogether has about 65 years of experience in that department. So we're well versed on what's going on in the marketplace and in the industry. So you can call us on our main number and just ask to speak to an information specialist. And what we do is we help people connect and navigate. So just give us a call and we'll be glad to help with that.
Awesome. Thank you. Definitely will. Miss Gina, so the question comes back to for home care. So someone's saying that they currently have some home health. So why would I need home care if I have home health?
That's a very common question. So the home health are the skilled services. It's your physical therapist, occupational, speech, nursing. They can also send an aide for short visits, for typically about an hour. The visits are about an hour. So that's home health. So home care comes in when you need longer services. I need someone 4 hours in the morning to make breakfast and lunch and help me get dressed. So home care is the ones that come and stay, and we reinforce what the therapists do. We do exercise reminders. We team up with home health. So if you only need short visits, that's fine. But the home care comes and stays for a longer period of time.
And we have I think it was earlier asked in chat, there's on our Aware Senior Care, if you go to Aware Senior Care website, circle of support, you'll see download and resources. And we have what we call, it's actually a hospital discharge card that we created. And that's where it explains home care, home health, hospice, palliative care, kind of. So you can download that. The other thing I'll say to the audience is that we will make a PDF of this presentation, and it'll also be on download. So no worries, you can get that info. Mike, do we have any raised hands at the end of the QA here?
I thought I saw a hand that went up, but it went back down. I don't know if Harold still has a question or not, but I did see a hand that went up.
Harold
Yeah,
Wilson?
looks like Harold. Yep, Harold Wilson raised their hand. Let's see if we can unmute you there.
See if you can get Harold to go live.
Harold, are you there?
Well, he's not. Harold, you should be able to speak to us. You're not muted.
Yeah.
Yep.
Hmm.
Or maybe you can ask in
Not
chat.
anything.
Oh,
this is
it's the
so
daughter
the daughter
of Mr. Wilson.
Yeah.
Well, thank you very much for joining us. If you want to put the question in chat, we'd love to answer it or take a shot at it.
Mm-hmm. In the meantime, while that question might be coming in, Scott, there's a question. Does the resources for seniors do events by chance?
We don't personally put them on, but we attend probably 35 to 45 health fairs. We do speaking engagements, and we just encourage people to call us and set up. We can come to churches, civic groups, whatever, whoever wants us. We even do it with businesses.
Oh, it's great. We've done a lot of events, resource for seniors. The senior centers have events. We have Heather and Susan on the call. We've done them as team, and it's so cool to show up at churches and the resources, the senior centers, to do events and educate people. So, thank you, Scott, for going out there on the road to let everybody know about resource for seniors.
So there's a question did come in. How would you address needs that are hard to decipher? And so in other words, the parents say, "Oh, I'm fine, but I know that help is needed." So how would we address that?
Sometimes it's much easier for someone who's not a family member to address it. Because I will even tell you that in my family, I'm the nurse and this is what we do, but my mother doesn't listen to me because she's fine also. So having a non-family member and a professional and just listening, and to really listen. I don't try to contradict when she says the fine and the daughter saying, you're not fine. I just listen, because in that person's mind, they are fine, but we can still identify issues without calling the person out on it, without making them feel badly. Because it's listening to them, and we can talk to family members, and we can really get a really good sense just through conversation. And sometimes we'll say, well, Mrs. Smith, it sounds like you're doing really well with your house, and you live with your daughter. And, your daughter would like a little extra help around the house. She'd like help with the laundry. She'd like help with meal preparation. So would that be okay if we bring somebody in, and she would be here with you while your daughter's at work, and we could get some of the tasks done to help out your daughter? So there might be a way to segue in. And you'd be amazed at how many times that mom likes that.
I had just to kind of a piggyback on that too, because we often come across that. And I think just letting the folks know that, what, this is not in stone. We can change, we can let's just maybe give it a shot for a couple of weeks. Let's see what happens. And a lot of times, they start to build that relationship, hopefully. And so things will hopefully be smooth out a little bit. So
that's a good point.
Well, we hit our 1 o'clock, and but that's a great way to end up. That was a wonderful question, and that is one of the. We had a webinar a couple of weeks back called "What do you do when your loved one refuses home care?" And please watch that. But the final test, you've done your research. Now you know home care. You whittle it down to 3. You make your phone calls. You like Micah. He's an awesome guy. So I'm going to give Aware Senior Care a shot. The final test is when Gina or a nurse, in some states doesn't have to be a nurse, but when they walk in the door, what did they look like? How did they treat you and your mom or dad? Did they listen? That, are you comfortable? You have it, you kind of get that instinct, and if you're not comfortable, my advice is to go to door number 2. You have choice, and we always say, you don't have to settle. This is your life, and you want to find the best agency. So you follow that process. But ultimately, when they come in and you feel good about their listening, and they're saying the things, and they're addressing the most important things, give it a go. But you're still not locked in. So listen, I really appreciate you bearing through the little beginning when screen issues that I had. It's one of those days. But Angela, Scott, thank you. You're great people, partners, what you do for people and helping people. All of you that have joined us, our friends, and Heather and Susan, and we're blessed to know you and work with you in the community. And, those of that, the great question we just had, do your homework. I hope you've gained a little bit of insight from the people, the great people on this call. Call any one of us if you've got a question. Thank you for Fedora Howard Wilson. And God bless you all, and have a great day. And thank you for joining. Stay safe.